Hello, everyone. Welcome to the third day of Kidney Action Week. My name is Shayla Harris, and I'm looking forward to being your moderator for this session. Kidney transplant, navigating the waitlist process. I am the Associate Director of Administration at the American Kidney Fund, a 12-year kidney transplant recipient, and a proud advocate for the 37 million Americans with kidney disease. Now I'd like to introduce our awesome panelists today. First, we have Dr. Velma Skettlebury. Dr. Skettlebury is the first African-American female transplant surgeon in the United States. Currently, she is a professor of surgery at Texas Christian University, and she serves on the board of the National Minority Organ and Tissue Transplant Education Program. She received her training at the University of Pittsburgh Medical Center. Following that, she was the director of the Gulf Coast Regional Transplant Center in Mobile, Alabama, and later relocated to Delaware. She recently retired from her role as the Associate Director of the Kidney Transplant Program and Director of Outpatient Services at Christiana Care. Next, we have Hannah Graves. She is joining us today to provide the social worker perspective of the challenges of the waitlist process and potential resources patients and families can use. Hannah is the transplant outreach social worker at Piedmont Transplant Institute in Atlanta, Georgia. Prior to this, she worked in hospice, short-term rehab, and in dialysis. She started her career off working at the United Way of Greater Milwaukee after graduating with her master's in social work from the University of Wisconsin-Milwaukee. Finally, I'd like to introduce Mary Balaker. Mary was diagnosed with kidney disease at the age of 9 years old and is a 4-time kidney transplant recipient. She has experience being on the wait list as well as receiving a living kidney donation. She is a proud AKF ambassador and healthcare advocate. In addition, Mary is a public health professional and has worked in transplant as a resource manager. Now, before we get started, I want to encourage everyone to join, to please type your questions and comments into the window next to or below the Facebook Live video stream. And we'll try our best to get to your question during our Q&A segment at the end of this talk. Now, to start us off today, I'd like to turn it over to Dr. Skettlebury to provide us with an overview of the transplant evaluation process. Dr. Skettlebury?
Thank you so much. I'm delighted to be here this afternoon. And so I'm going to talk to you about the kidney transplant process and what to expect when you are coming in for getting on the wait list. And you have to understand that for patients with end-stage kidney disease, there are several options for treatment. It includes dialysis, which would include hemodialysis as well as peritoneal dialysis, and kidney transplant. And all of these are considered renal replacement therapies. And while hemodialysis can keep your kidneys functioning, the body really does so much better when you replace your diseased kidneys with a kidney. And this is the best treatment option because it allows for better clearance mechanisms that may not necessarily occur with hemodialysis. Now, how do you get a kidney? A kidney can be from a deceased donor, that is someone who's declared brain dead. Family or the patient themselves consents to organ donation before their death. And so organ donation proceeds with consent. Living donation can occur as 99% of us are born with 2 kidneys, but we have the option of giving one of these kidneys to someone in need, someone we love, someone we want to be able to help. And so it's important to know that there are 2 sources in terms of kidneys, both from living donors, and the living donor does not necessarily have to be a relative. So many times we think of related donation. So it can be a friend, it can be someone who just has a vested interest in seeing you get better and seeing that you return to normal life. And so it's important to make sure that you start the conversation early in the process, even before you get to the point of dialysis. It's important to understand your numbers, follow with your primary physician. If you refer to a nephrologist and you're going from the various stages of kidney disease, it's from stage 1 to stage 5. When you hit stage 4, generally you need to have that conversation about what are my options? What are the options for treatment? And if possible, can you avoid dialysis? Can you get that transplant, what we call preemptive transplant, at a time that before you start dialysis, not earlier, but to have that renal replacement therapy be with a kidney transplant and avoid the stages of needing to have dialysis, because you do not need to be on dialysis to get a kidney transplant. So there are many benefits to that because, one, it avoids the complications of dialysis, and you're in a better condition to do so much better after transplant. Next slide, please. And so what is involved in getting on the wait list? And it's important that, as I said before, having that conversation. Maybe you're considering, I'm not sure I'm a candidate for kidney transplant, but it's better to not rule yourself out, but go through the process. Learn more about the process, because the more educated you are, the better decisions you can make regarding your health and for that of your family also. So you want to be able to be referred to get that information. You want to learn about the options for dialysis, whether it's home dialysis or in-center dialysis. And so you also want to learn about kidney transplant. You want to learn about the benefits. And so you can go through the process. It doesn't say that you have to agree to live a transplant. It's a learning process, so you can be well informed. And you can refer yourself to that transplant center. You can be referred by your primary doctor. You can be referred by your nephrologist. And so your dialysis center, if you are on dialysis, have that option of and should refer you for transplantation. If you're not on dialysis, that early referral can occur. And even though you're not on dialysis, as long as you have what we call an estimated EGFR, or glomerular filtration rate, if your kidneys are functioning at 20% or less, even though you may not be on dialysis, you can still get evaluated for transplant and get on the wait list process. You can also be on more than one transplant list based on what we call your regional area or your catchment area. So you want each transplant center is served by a region that really designates where those organs come from. And so if you are living in New Jersey, you can be on a transplant center in Pennsylvania. If you're in Maryland, you could be in a transplant center in Delaware. So you can be in, as long as you have that ability to get to that transplant center, to be followed up by that transplant center, and to come back and forth for your post-transplant visits. So it's important to start that evaluation process early on and get listed, get evaluated for a living donor if that's the process. And talking about that early on allows for you to initiate the process. It's important because right now, the earlier you are on that waiting list, if you don't have a living donor, the more time you can incur as each day. So if you're on there without dialysis, you can still, as long as your EGFR is 20%, you may not be ready for a transplant, but you can still be building a time such that when you get to that point of needing a transplant, you already have X number of days or X number of years. So being on the list doesn't necessarily mean that you will get transplanted immediately, because you have to go through a battery of tests, and we'll talk about that, and the things you have to go through. And you also, if you don't have an immediate donor, it will take time based on your blood type to get transplanted. Next slide, please. And so what is considered in the evaluation process? First, you have to be healthy. We want to make sure that you are going to survive and do well after that transplant. We don't want to say, so we put you through a battery of tests to make sure that your physical health is good, that your mental health is good. And when we talk about physical health, we want to make sure that if you have underlying heart disease, that's worked up. You want to make sure you don't have any liver dysfunction. We do tests to make sure that your systems are good, that your heart's good, your kidneys are diseased, but you want to make sure that your liver and that you don't have any evidence of cancers, infections, or things that may limit the ability of you to do well. Some patients come to transplant and end up with being diagnosed with a cancer, but they can go have that cancer treated and still get transplanted subsequently. It's important to have a good support system. We want to make sure that you have someone to bring you back and forth when you are unable to drive after your transplant. We want to make sure that we have appropriate living conditions so that you can receive your medications when they're sent in the mail. And mostly, initially in the startup, you will see the financial coordinator who will go through with you what it costs to get a transplant, what funds you need, what insurance you have, and how that insurance is going to play a role in your transplant care, your post-transplant care, as well as your medications. And you'll also see a pharmacist who will also go through that process. So we want to make sure that you're healthy enough to withstand the transplant itself, but also to be able to afford those medications that are required after transplant. Next slide, please. And so we know that there are health disparities in kidney transplant. Unfortunately, when we look at end-stage kidney disease, the two leading causes of kidney failure are diabetes and high blood pressure. And for Blacks, there are 3 to 4 times more likely to develop kidney disease and kidney failure as a result of high blood pressure. And so it becomes important that if you have a family history or long history of hypertension, that you get checked to make sure that you're not on the path to having chronic kidney disease or potentially develop end-stage kidney disease without, we know kidney disease is not very symptomatic. And so some patients are unaware that they're predisposed to having end-stage kidney disease. Hispanic and Latino communities are 1.5 to 2 times more likely to develop kidney failure as well. And both groups, both Black Americans and Hispanic Latino communities, are less likely to be placed on the waiting list prior to dialysis compared to white Americans. And why is that? Because the diagnosis often comes later. Many patients are diagnosed in the emergency room now for the first time hearing about kidney disease without having that early recognition and treatment by having that annual exam. So it's important to get checked. It's important to understand that having your annual exams, having your urine checked, having your blood, just as you want to know what your blood pressure is, what you want to know what your cholesterol is, you want to know what your kidney function is. You want to know, am I at risk because I'm diabetic? Am I at risk because I have a history of hypertension? And you want to be able to understand those risks. And if you're diagnosed early, you have a better chance of being able to get transplanted preemptively. That is before you start dialysis. And it's not done at a time when you're absolutely doing well. We do it when there's a decision made, even though you've gone through the workup. If you get to that point where it says you're on the list, but we see that your treatment needs to occur. And that treatment, if you're not on the list, will be hemodialysis or peritoneal dialysis. If you're on the list, will then be a transplantation. So it's also important to realize that the rate of living donors for Black Americans as well as Hispanic communities is significantly less than the white counterparts. And that's important in talking to your family, talking to your friends, talking to those around you, your loved ones, about the importance of organ donation, given organ donation. If you're aware that your family is at risk for the kidney disease and you discuss it, you're more likely to say, what can I do before I hit dialysis? I can get a kidney transplant. My child can give me a transplant, my brother or my sister. And it is on us as the physicians in the transplant center to make sure that those living donors are not at risk for kidney disease. We're not going to take your loved one and put them through the process of donating if they have underlying issues. So for living donors, it's going to be the most thorough exam they're going to have. And so it's important to, one, know your risk factors, discuss it with those around you, and consider living donation. And that comes through having those discussions, being aware of what your risks are so that you can plan early on before you're diagnosed in the late stages. Last slide. And so what are the barriers to transplant and getting on the list? Certainly financial is one of the big ones. While you have end-stage kidney disease, you will be covered by dialysis with Medicare. If you are disabled, you would have Medicare. However, and Medicare covers the workup for kidney transplantation. It's important, though, that after the transplant, that you have that insurance that allows you to be able to afford the medication, that you have those funds that allow you to be able to go back and forth to the transplant center. If you're working, would your job would you be able to take the time off? So it's important to look at and this is part of the work on transplant, is that you will have a social worker and a financial coordinator who will go over what are the funds needed to get you through the process. What are the insurances and that you have, and how will they cover the medications that you will need to receive after transplant, after you leave the hospital? So those barriers are important to address, and not every patient is able to get through those hurdles, but the goal of the financial coordinator is to come up with ways to meet those needs. And some patients have to fundraise, or some patients we come up with medications that may be cheaper. So we try to make sure we can eliminate those barriers for all the patients. There is the perceived lack of social support among transplant centers, and it becomes important to make sure that you have that support. If you live alone, it can be to your disadvantage, because when you're unable to drive yourself and when you're unable to get back and forth because you're not feeling well, that can be a hindrance. So we sit with you beforehand to make sure that we discuss who is there for you. Are there community members, church members, other support persons who can help you through the process? Yes, you can do it if you live alone, but with that initial 6 weeks to 2 months when you're unable to perhaps drive yourself because of the pain, because of the medications, it's important to have that support system. What if you got sick and it's in the middle of the night? Who can you call to bring you to the emergency room? Those things are very important, and we go through with the social worker how we can eliminate those barriers. I have to say that it's an important aspect of getting on the list and staying on the list. So that is something we tell patients, to make sure you research and see what are the possibilities for you. Certainly, some of the barriers are the fact that chronic kidney disease is not identified early on, and that is a matter of appropriate medical care, seeing the doctor. So many patients do not have the appropriate insurance to be able to say, I can have an annual visit. They may be totally uninsured or underinsured, and so therefore they're only using the emergency room when they need to and not seeing a physician. And so the barriers to transplant are late diagnosis. If you're not diagnosed early, then you're missing opportunities to be treated, perhaps go through some preventive therapy that may delay the onset of end-stage renal disease or delay the need for dialysis. And so early identification of kidney disease is important. When you're diagnosed late, your options may not be as many as if you're diagnosed early. Certainly if you're diagnosed in the emergency room or the hospital, you're going to start immediate hemodialysis because they urgently need to cleanse your system because you are in uremic kidney failure at that point. So that limits the ability for us to be able to help you until we get you past that urgent dialysis, and then in the later stages, after you're stable, then thinking about being referred to transplantation. And some patients may not do well in that early phase of dialysis, and therefore may not be a candidate for kidney transplant. Next slide, please. So these are some resources from the kidneyfund.org that will give you more information about kidney organ donation, as well as kidney transplant and getting on the waiting list. So thank you so much for allowing me to present to you today, and I turn it over back to Shayla. Thank you.
Thanks again for that overview, Dr. Scantlebury. If you're just joining us, welcome to our session on navigating the kidney transplant waitlist process. As a reminder, we will have a Q&A at the end of our time today, but you don't have to wait until then to ask your questions. Drop your comments in the window next to or below the Facebook live stream or the chat box below if you're here with us on the Kidney Action Week website. We will try our best to answer as many questions as possible. Now I'd like to hear from Hannah. As a transplant outreach social worker, she's here to provide some tips for individuals either considering transplant or who are already on the wait list. Hannah?
Yes, ma'am. Thank you, Ms. Sheila. I am so excited to be here today. Transplant is one of my favorite topics to talk about. I've had the great fortune of seeing patients through the evaluation process on the wait list and transplanted, and then to get to see them in the post-transplant clinic living their best life with their kidney transplant. So I feel very confident that I can give you some gems today to hopefully inspire you to pursue transplant. In our transplant journey, when I have found patients to be the most successful, so they come in for their evaluation, they're well rested, they got a good night's sleep the night before, they bring a support person with them. This is not a requirement, but I can't even tell you how much information you're going to get in that one day. So having someone there with you to be a second set of ears and eyes is so important. So when the day is done, you have someone to discuss all this with. Having that support person also shows to your transplant team that you are committed, that you are on this journey for the long run, and you've brought people with you to be a part of this with you. And so one of the things that I have found to be the most successful is when patients treat this almost like a job. Your life is actually more important than a job, but if you can equate it to a job, then you would think of preparing yourself for your job, coming in, being enthusiastic if you can be, asking questions if you have them, listening intently. If you don't understand something, then stop the team and ask them to clarify. You're not supposed to know all these things just intrinsically. There's no way to know. These folks have gone to school a long time. They've been in this program a long time, and they have a recipe for success that they would like to give to you if you are willing to receive it. And that's a really important part that I want to emphasize is taking responsibility for your own health. And that sounds kind of obscure. You're like, well, of course I'm taking responsibility. It's my health. But it really is important when you are going through this transplant process to understand that the transplant team is not trying to punish you or make you work for it or any kind of that nonsense. They are the stewards of this really valuable resource, a transplanted organ from someone who passed away and gave the gift of life. It's a really big deal. And so with that responsibility, they have to make sure that you are prepared mentally, physically, and financially to be successful, because there's no point in transplanting a kidney to you if you're going to lose that kidney in the first year because we didn't help prepare you. It's just as much our responsibility to help you be successful as your own. So I just really want to emphasize the team part of it, but also you are the leader of this team. And what do you want that to look like? So part of that also is when you go for a job and you go in for a job interview, you are interviewing your transplant team as much as they are interviewing you as a candidate, because these are folks that you're going to be working with for your foreseeable future as you and this kidney get underway. So I just really encourage you to take this very seriously, but also see it as the ray of opportunity and hope that it is, because we know that the human body does so much better long-term in terms of quantity and quality of life. So your transplant team is really excited for you. They want you to be a good candidate. They want you to be successful, because when you are successful with your transplant and living a long and happy life, that also reflects well on their program so that they can continue to provide transplants to people. So I just really want to emphasize that this is a positive, hopeful experience. If you have questions, you have a team around you. Your dialysis team, if you're on dialysis, can be of good help. If you're not on dialysis, your nephrologist would be your greatest cheerleader. There are great supports out there to keep you going, but I just really want to emphasize that this is a very possible process. A lot of patients have done very well with a transplant, have had a very positive experience. And although there are bumps in the road when it comes to, oh, now I have to go get an updated stress test or a colonoscopy or whatever it is your transplant team is asking of you, remember that they are asking this of you because they want you to be successful. And the only way that you can be successful is to go through the process of really preparing yourself. One of the things that you might have heard in Dr. Scandalberry's presentation that may have caused some concern is the financial part of transplant. And one of those things that we have been able to do as the social work team in transplant is there's a lot of really great resources out there to help you, but they are for emergency situations and should not be relied upon, especially when we know and have time to prepare you for a transplant. So some of the things that you might want to think about, either setting funds aside, or if you have talented family members who can cook or bake or sew or have a restaurant that they could do a fundraiser for, there's infinite ideas, excuse me, is to just try to put some money aside, because it's almost like you're preparing for a child, isn't it? You are having this new organ that's going to give you a new lease on life, and you want to be able to successfully live with it. And if that requires a copay for a medication or gas money to come to and from the transplant center, or if you need to stay overnight at a hotel the night before because you have an early appointment at the transplant center, that you have those funds. So not only do you have them and can be successful, but then you're not stressed out about it the night of, the day of, or how you're ever going to get there, because we used our time successfully in preparing you. So kind of my main takeaways is to keep your optimism and enthusiasm with this process, and also take responsibility for what is being asked of you, and do try to ask questions and work with your team and communicate if you are struggling, because that is not the goal, is to rule you out by making things difficult, but really to help you prepare. And these folks have really created a wonderful recipe on how to help you be successful. And if I can encourage you to stay the course and reach out when you need help, and keep your mind positive, because it's a really amazing thing to be able to have a transplanted kidney and to go on and live your life, albeit differently than it was before, but without having to be reliant on dialysis to keep you alive. So really excited for you to consider transplant. There's a lot of great programs in the United States, and each one of them would be more than happy to work with you if you are willing to work with them. So thank you so much for the opportunity to talk with you.
Thanks, Hannah. You know, it just brings great memories back from 12 years ago when I received my transplant. Once again, if you're just joining us, welcome to our session on navigating the kidney transplant waitlist process. As a reminder, we will have a Q&A at the end of our time today, but you don't have to wait until then to ask your questions. Drop your comments in the window next to or below the Facebook live stream, or the chat box below if you're here with us on the Kidney Action Week website. We will try to answer as many questions as possible. Now, I was lucky enough to have my sister step up to be my donor. Hannah, what tips do you have for patients when they're looking for a living donor?
That's a really great question. And I know a lot of folks are very private. They don't want people to know that they're sick or that they're going through something. And I really encourage you, if you can't do it for yourself, you can't tell your story because you need help in a kidney, think about all the other people in the United States and in the world who have kidney disease and could use the help to get the word out that kidney disease is happening, and it's silent. It doesn't show up on your face. So I really encourage you, if you can, be brave and muster the courage to start telling your story, because I think you'd be surprised how many people don't realize what you're going through because you wear it so well and you're so tough, or whatever the case may be. And if you don't say anything, then they will never know. And if they don't know and they find out that they could have helped you, I would imagine they'd be pretty upset with you. I know I'd be upset with my loved ones. If something was going on with them that I could have helped, if I can't give my kidney, then I can help spread the word for their need. And you just don't even know who you're going to talk to that had it on their heart that you may need something or they might be able to help. So asking for help is one of the hardest things we do as people, but it is one of the greatest gifts that we can give each other, is to help each other through this process. You're not meant to do this alone. You have a whole village around you. Please share your story, if nothing else, to get the word out about kidney disease and help your community understand that the need is there. And I think you'll be surprised of how interested people are in learning more, even if they can't help you directly.
Well, thank you, Hannah, for those encouraging words. Now I'd like to turn it over to Mary. Mary has the unique experience of receiving 4 kidney transplants and is here today to share her story with us. Mary?
Shayla, thank you for your kind introductions. I'm happy to be part of the AKF Kidney Action Week. This morning, I'd like to share a little bit more about my experience. I was diagnosed with kidney disease at the age of 9, and at that time, they didn't transplant children or dialyze them. My parents had been told that I had about 6 months to live. I was fortunate to have a bit of a remission. I say that luckily medical science moved forward, and at the age of 17, I went into complete kidney failure and started on in-center hemodialysis. My brother Doug realized one day while at the dialysis center with me that I wasn't doing very well, and he decided he wanted to be tested. He was a perfect match. That was my first transplant. To summarize, I've had 4 transplants. My first was my living donor, as mentioned before, from my brother Doug. I had that transplant for 4 years. My second was a deceased donor, and I had that transplant for 4 years. The third was a preemptive transplant, and I had that 11 years. Today, I've had my 4th transplant, which was also a preemptive transplant, and I'm 22 years out. In December, I'll be 23. My lab works great, and I'm very happy to say that things are going well. On each time, I was on the waiting list because we didn't know whether there would be a match within my family. My experience between living donation versus deceased donation was different. As with a living donor, I didn't feel alone on the journey at all. Every step of the way, my brother was there. We were in it together. I was so grateful for my brother. As a deceased donor, I was sad for the family. I had a lot of questions, worries about the donor match. Was the kidney going to work? Did I have antibodies? Would I reject the kidney? There was just lots of emotions. My experience on the waiting list brings back many memories for me. The first time was 6 months, second was a year and a half, third was about a year and a half, and 11 months before my 4th. I was scared but hopeful. I felt guilty about the donor. The hardest part for me was losing my transplants, telling my brother, feeling guilt about the donor that gave me the process, the precious gift of life. So I think in all estimates, I think it was difficult losing a transplant, but I also knew that it was also my gift. My 3rd transplant, I was living in California. So I was listed in California and also in my home state of Wisconsin. Thinking the distance, I might not be able to make the timeline for the transplant in Wisconsin. I thought I'd get listed in both places. Things to think about is getting pre-authorization for your insurance company, because of the transplant out of state. I needed to make sure all my lab work was up to date in both places. Evaluation tests were done, such as EKG, cardiac stress test, chest x-ray, colonoscopy, just to name a few. I was fortunate that I got the call while at work one day that Wisconsin had a kidney, for I was life flighted from that hospital that I was working at to LAX. I received my transplant the following day. Due to out of state, I was required to stay 1 month within the state of Wisconsin in case I needed medical care. My medical staff were a huge part of my life, especially my nephrologist and the transplant coordinator. They were there every step of the way. When they called to tell me that I had a kidney, when they called to say my lab work was not up to date, when they called to say my lab work had kind of plummeted, they were there and they still are today. I was very fortunate that I had them as part of my team. I also, my social worker, my transplant surgeon, the dietitian, every step of the way, each person played a very special part. It's important for me before my transplants, and as well as it is today, to stay healthy. While I was waiting for the transplant, I knew I needed to stay as healthy as I possibly could. I was very anemic, and so that was difficult. I didn't have the energy. I didn't have the drive. I was just trying to work and get through things the best I could. I tried to exercise by walking. I watched my diet, my salt intake, so I didn't get too puffy. I watched my protein. My potassium was also out of whack. My blood pressure was out of whack. I had to watch them all. I think when I talk about the takeaways, I think some of the things that I really feel that I see as my takeaway is feel free to list multiple places. List as soon as possible, and don't ever give up hope. And I think most of all, be your own advocate. Thank you.
Thanks so much, Mary, for sharing that with us. It's truly powerful, your testimony. If you're just now joining us, welcome to our session, Navigating the Kidney Transplant Waitlist Process. As a reminder, we will have a Q&A at the end of our time today, but you don't have to wait until then to ask your questions. Drop your comments in the window next to or below the Facebook live stream, or the chat box below if you're here with us on the Kidney Action Week website. We will try to answer as many questions as possible. Now, Mary, I'm curious, what were your experiences post-transplant? Was the recovery process challenging? Did you feel better right away? What did you really go through?
I think my post-transplant experience, I think the biggest is that I was sore from the surgery itself. You know, it's a pretty large incision at the time. Yep. And I think having that was probably the worst part, but I think really the thrill of having a working kidney, I think the emotional high took over the physical pain. I think my recovery itself, I think it took a bit, but I felt better actually right away. I think my energy level, because I was so severely anemic and not having a good working kidney, the nausea that I felt, I think also the drain from dialysis, it was difficult.
Thanks, Mary. Like I said, that your story is truly powerful to all of us. Before we start taking questions from the audience, I wanted to share a resource link once again that Dr. Scatterberry had shared with you. It's the www.kidneyfund.org/kidney donation and transplant. And there are plenty of resources for you to answer any possible questions that you may have. All right, so we are now at the Q&A portion of our segment. So now we're going to go over some questions that we have from our audience. All right, the first one, Hannah, can a person register for multiple transplant lists, or could that harm your chances of getting a kidney?
Oh, goodness. We encourage, if you can, list at multiple transplant centers, please do. Some of the factors that you might want to think about when you're selecting different transplant centers is where do you have support? We've talked about support quite a bit. And, you know, traveling all over the country, Ms. Mary mentioned that she was living in California and had to get back to Wisconsin for her transplant. You know, is that something you're able to do? Do you have the financial resources? Or say, for example, so I'm in Georgia, and if you're listed at a Georgia transplant center and you have family like in Kansas, they perhaps getting listed at a Kansas transplant center would be a great idea. Or, for example, if you can drive to, so if I'm in Georgia, there are transplant centers in Florida. Can you drive to a transplant center? So we in the transplant community do encourage you to list at multiple centers to almost give you an opportunity to play more than one lottery and or give yourself an opportunity to access resources that are outside of the transplant area of one transplant center. So very encouraging that if you can do that, please do. It just increases your opportunity to receive a transplant, which is ultimately what we want for you.
Great, thank you. This question is for Dr. Scantlebury. So race and ethnicity are important in the origin of the donor to the recipient. There may be a misunderstanding that maybe possibly it just may be the blood type that makes that designation. Could you please confirm?
Thank you so much. It's important to realize that kidney transplants are matched based on blood type. That's the first category. So patients will be put on the waiting list or worked for a kidney to make sure you have a compatible blood type. For instance, if you're blood type O, you are a universal donor. And so you can give to a blood type O, you can give to blood type A or blood type B. If you are receiving a transplant and you are blood type O, you can only receive from a blood type O. So it's important to make sure that there's compatibility. So when we say someone's kidney was a match, we're generally, first of all, saying that they were compatible match based on blood type. The second step is to make sure to see, do you share anything in common with the donor? And so we know that within different ethnicities, we have a higher percentage. We may see one of more blood type than another. Within African Americans, we tend to have a lot more B blood type than O blood type. So from that standpoint, the majority of people on the wait list are going to be blood type O. So if you're rare blood type, like blood type AB or blood type B, you may wait longer. And so certain blood types, like blood type B, are given extra points to be able to not to have to wait as long as blood type O.
Okay. Thank you for that clarification. Now this question is for Hannah.
Can I just say,
sure.
Can I just add something about multi-listing? You need to realize that some transplant centers will say, it's no advantage for you to be on our list and our neighboring transplant list because we're sharing kidneys from the same geographic area. So it's almost like picking from the same basket. So you want to be able to say, I want to be on another transplant list that's in a separate geographic area from that standpoint. I hope that makes sense.
Thank you for that. Hannah, this question is for you. We have an audience member whose son was sent to Alabama to get on the transplant list there, and they were told his insurance wasn't covered. Should they ask to be referred to another transplant center?
Insurance is always a really hard one, right? Because you certainly want to go where your insurance will cover the cost of your services. Nobody has infinite dollars to cover the cost of a transplant, which we would assume is very expensive. So some of the things that I'm familiar with insurance is to call your insurance and say, well, what transplant center, will you support? Would you do an authorization for us to go to this transplant center? And kind of have those conversations. I know no one wants to call their insurance, but they're actually very friendly and nice. They do want to help you, believe it or not. But you do have to kind of take that initiative and reach out and or work with the financial coordinator at your transplant center for them to see if they can get out an authorization, maybe just this one time your insurance would consider. But more often than not, your insurance sees the actual economic advantage to you as a patient to not be on dialysis long-term, which is a very expensive treatment modality. You are actually more cost-effective with a transplant than on dialysis long-term. So your insurance, for lack of a better word, is financially motivated to help you receive a transplant. And so reaching out to either your insurance or working with the financial coordinator to find a transplant center. But please just don't take that lying down, ask a question, follow up if you can, and advocate, please, to be seen at a transplant center.
Thank you. Dr. Scantlebury, for somebody who's on hemodialysis, what are the qualifications to receive a transplant?
Generally, as I said before, it's about being in good health. You don't have to be on on dialysis to qualify for a kidney transplant. You just have to have an estimated kidney function of 20% or less. And also make sure you're healthy. You go through the test to make sure your heart's in good condition, you don't have any cancers, you don't have any overwhelming infections. But the biggest thing about being on dialysis is that the longer you are on dialysis, the more likely you are to, especially hemodialysis, to suffer from cardiac disease or heart disease. So the biggest challenge for transplant centers is making sure that your heart's in good condition to survive a kidney transplant. So if you're on dialysis 8 years or 10 years, I would expect that your heart condition may be worse because of being on hemodialysis than someone who's been on dialysis for 2 years or not on dialysis. So those years on dialysis matter. It does cause deterioration in your cardiac function.
Thank you. Thank you. Now, this question is for Mary. So this person has been on the list for a very long time and they're losing hope. How did you keep your spirits up?
You know, I think that is really a good question. I think being on the wait list, and oftentimes I think people are on the wait list for many, many years. And I think one of the things is my family and my friends really were very supportive. I think because I was diagnosed with kidney disease at a very young age, I always tried to pretend that I was like the other kids. Yeah. And I think a lot of that kind of rubbed off on my whole life, where I wanted to be like other people. And I think because of that, I really tried to find normalcy. I think sometimes it's just finding that one thing in the day that gives you joy. And I think that's exactly what I would do. And when I was having one of those really bad days, you know, where you want to give up hope and you feel like this is never going to happen, and whether you're on dialysis or not on dialysis yet, I think it's hard. And I think when you're trying to just kind of navigate the system and in trying to have some kind of normalcy and just feel better, it's hard. But I think, again, I really tried to relate back to that. If I could find one thing that gave me joy in that day, whether it was, you know, walking down the street with my dog, whether it's, you know, walking down to have coffee with my neighbor, or whether it's, you know, calling, you know, your mom or your friend or whatever, whoever it might be that can kind of give you comfort. And I can tell you that it doesn't come easy. There's days that you just want to give up, days you just don't know if it's ever going to happen. And I think that's the big thing, I think, is not give up. Be your own advocate. I think we were talking about insurance. Well, I was denied insurance to come back to Wisconsin and have my transplant the first time. I didn't give up because I was afraid that I needed to make sure that all possibilities were covered. So make sure that you cover all possibilities, I think, so that you feel like you've done it all. And once you feel like you've done it all, then it's just kind of up in the air of when that day might come. So I wish you the best of luck and find joy in each day.
Thank you so much for those words of encouragement. Dr. Skettleberry, right now with kidney transplants, do you know if it's mandatory for both recipient and donor to have the COVID vaccine?
Well, certainly it's important, as most programs will tell you, that for patients who have a potential recipient with kidney disease on dialysis, the risk of dying is about 20% for people on dialysis from COVID. So it's important to get that vaccine because no one wants to risk a patient dying from COVID because you're receiving these medications that's going to wipe out your immune system and therefore make you more likely to suffer from it. So it's very important to get the vaccine to prevent the consequences after the transplant. Not all programs are requiring it, but the majority of them are saying, this is, if you want to save a life, why not get vaccinated? Because we know the consequences for the unvaccinated in immunosuppressed patients can be detrimental.
Thank you. Now, Hannah, at what point can a patient get on the wait list, and what does their GFR need to be?
Thanks for asking. That's a good question. Dr. Scantlebury mentioned that it has to be, your GFR has to be at 20 or below, and you don't have to be on dialysis. You can try and get a kidney transplant before you start dialysis. That would actually be the goal for all patients if we could. Unfortunately, we just don't have the number of kidneys needed to catch people before they need to start dialysis. So that magic number for those of you keeping track at home is a GFR of 20 or below. And that does not necessarily mean that you are on dialysis at that point. And when you start dialysis is up to you and your nephrologist based on what your lab readings are and how you're feeling, maybe your symptoms. The whole goal to try and keep you from ever needing to be hospitalized and start dialysis so that you can feel better ultimately and bridge you until you are able to get a transplant.
Thank you. And to piggyback off of that, Dr. Scantlebury, at what point would you be eligible for a preemptive kidney transplant?
We encourage patients who have stage 5 kidney disease to get worked up for a kidney transplant. If you have a living donor, is much more appropriate because then we can plan to intercede when we see that your deterioration has gotten beyond the ability to control it, such that you may not be able to control your blood pressure anymore. Your fluid balance or the amount of fluid we can get off of you is getting to be a problem, or your numbers, you're getting so uremic that it's getting detrimental to your health. And at that point, if you have a living donor, we then will intercede with the transplant. For patients who are on the list preemptively and are unable to find a deceased donor, at that point, they will then be told they need to initiate either hemodialysis or peritoneal dialysis because they can no longer survive without some kind of treatment. So the numbers itself isn't the one that guides the need to start a treatment process. It's how the patient's doing, how uremic they are, what's the fluid balance, can they breathe easily, are the medications working? So it's really about symptoms than numbers. Some patients will have a creatinine of 10, 8, or 12 before they start dialysis. Some people may need to be or get transplanted, and others, if they're the minute they begin to do poorly is when you intervene with treatment.
Thank you. Wow, there was so much valuable information that was presented today. So to close, I'd like to ask the panelists to sum up 2 things that are important to know about the kidney transplant waitlist process and 2 things they'd recommend doing when it comes to advocating for yourself around getting evaluated. Mary, can you start us off?
Sure. I think many people were mentioning about, the 20% GFR. And I think for me, I was so anemic and my GFR was plummeting. And I think getting on the wait list as soon as possible, staying in touch with your physicians. And I think what Dr. Scantlebury was mentioning, people start on dialysis, or I can tell you from having multiple transplants that each time was very different. Before I started dialysis the first time, my creatinine was 12. And I can tell you that, that was high. I mean, I was really sick. But I can tell you that after, with my second one, it was like 6. And I was very toxic, and I was, getting sick all the time, vomiting and nausea, and couldn't eat, and not being able to, just really keep any food in. So I think it really varies. I think the waiting list, I always say that if there's anything that we can do to eliminate that waiting list, that people wouldn't have to wait. That's really something I would love to see in my lifetime, because the pain that you have of waiting, as someone had mentioned that they had been on the list for a long time. My heart goes out to folks waiting, because it really, it is hard. It's like, I think also, like Hannah had mentioned, it's like having a child, getting your suitcase packed and getting ready to go, but you just don't know when. And you hope it's coming soon. And, do you put that vacation off because you're waiting, you don't want to leave town because, you might get the call. I think those are the things. It's a difficult time. I think having the wait list, obviously, depending on blood types and tissue typing and all of those things that go into it, it can be a long wait sometimes. And I think, again, if we could eliminate that, and also, living donors. I mean, I think that's another way to really help with that waiting list. And I know that I was going to get my second transplant for my father, but ended up with complications that I would have rejected immediately. So I think in all, I think the waiting list is a difficult place for patients. And I think the healthcare staff that helps us through navigating that system, and please reach out to them. They're there to help.
Thank you. Hannah?
Really well said, Ms. Mary. It is a very challenging process. And I think what everyone always wants to know is, where am I on the list, right? And so we always think of almost like a Santa Claus naughty and nice list with your like number 12 or something. And unfortunately, that just isn't the way that wait list works. It's more of an evolving database with constant information being updated. And really what you're waiting for is your matching kidney. It's almost like waiting for your true love. You can't rush that process. And you really want to make sure that you have the kidney that you're going to do the best with. So it is worth the wait. So I just really want to encourage you to, like Ms. Mary said, keep communicating. If you haven't heard from your transplant center and you're upset about not hearing from your transplant center, well, then give them a call and say, hey, I'm checking in. I want to make sure everything's up to date. And also try to remember that when you're asked to do something by your transplant team, it's not because they don't have anything better to do and they just want to make you run through the hamster wheel of the healthcare system. It's because they want to make sure that you're healthy enough to receive a kidney transplant and that you will be successful. And please remember, you are not alone. And try to remember that this too shall pass, and that you're going to get your kidney transplant, and it's going to be okay. But right now, when it's dark, just hang in there and know that there are wonderful people out there like Ms. Mary, who's done this not once, not twice, not 3 times, but 4 times, and you can see her on your screen. She's doing very well, and she's a very lovely person living her best life. So it doesn't mean it's not difficult. But keep the faith and know that you have resources, some of which right here through the American Kidney Fund, we are so fortunate to have them. So thank you for having me today, and keep the faith.
Thank you. Dr. Scudabari?
Thank you so much. As we were just hearing, it's important to realize that, I know from our perspective, the patients often feel like we're putting them through the mill with all these tests. As they're on dialysis, they're not feeling well. But also realize it's important to keep your appointments. It's important to, if you're unable to follow through with a test that's scheduled, let your coordinator know, because they're there to help you get through the process. Don't get frustrated, as we were just hearing, have that faith and hope, and understand that when we do these tests, it's really about trying to make sure you're in good shape so that you can do well after the transplant. And every year we want to make sure that you're updated. We want to make sure you're keeping up with your exams. But also, for your other family members, talk about your plight, talk about kidney disease and the need to find a living donor. Have that discussion with your family, because you never know who will be willing to step up and give you a kidney and get you off that waiting list. So there are people who are out there who we call altruistic donors, who just want to give just because they're willing to do something kind. And we've had many patients who have co-workers or people from the church step forward to donate the kidney because they heard this story. So share your story. You never know whose heart you will touch. Thank you so much.
you again, Dr. Skettleberry, Hannah, and Mary, for spending this time with us today and providing your expertise on transplant. Your professional and personal experience have provided the audience with a good overview on the waitlist process. Hopefully, the information and resources the panelists shared with you all today can empower you all to navigate the transplant process, to have important open conversations with your healthcare professionals. Thanks to everyone for turning in today. We hope this was informative and you had a chance to ask your questions today to our panelists. Up next is a breakfast cooking demo by Chef Linda Blaylock at 12:45 p.m. Eastern Standard Time. And following this break, please join our next session on Stage 3, CKD, Diabetes and Kidney Disease from 1 p.m. to 2 p.m. Eastern Standard Time. Now, if you haven't already followed us on Facebook, send us your email through kidneyfund.org and you'll be the first to know about our other resources like this. Also, make sure you check out the agenda for the rest of the awesome things going on for the rest of Kidney Action Week. Now, once we conclude this session, you will see a poll for a quick survey pop up, and please take a minute to fill it out and tell us how we did. Your feedback will be very useful as we plan future sessions. Thanks, everyone, and have a great rest of your day.